House Republicans released a proposal for replacing the Affordable Care Act Monday, and because it is the biggest policy that impacts us all directly, besides climate policy, but I know you like to pretend that's not happening, I thought I would give you all a quick summary. Hello all and welcome to my YouTube. Let's talk about I don't know anyone who really likes the Affordable Care Act, also known as Obamacare. However, without some form of a healthcare plan, 36,000 people are gonna die. So I was really excited to see what this new plan was gonna hold. I was hopeful that it would be an improvement and 36,000 people would not die. However, I expected that it would be worse and 36,000 people would die, and they would all be poor, old, or with pre-existing conditions. The current draft of the new healthcare proposal is called the American Healthcare Act, foreshadowing the A no longer stands for affordable, so I'm calling it the UWU, or the opposite of what everyone wanted. I want you all to know that I pulled the following information from a variety of news sources across the political spectrum, specifically to combat my own biases. However, you should know that I still hate the rich. That being said, this bill is already opposed by hospitals, the AARP, many conservative groups, the Ice Queen herself, Ann Coulter, and a plethora of Republicans have broken party ranks in order to come out in opposition of the UWU. Nevertheless, this is the starting line for wherever this hot mess is going to take us, and we should probably know what we're dealing with. The first major difference between the ACA and the UWU is that the ACA expanded Medicaid coverage, and the UWU freezes new Medicaid funding and puts a per-person cap on new funding, effectively shrinking Medicaid. Cue memories of protests against the ACA when people thought it was going to shrink Medicaid, even though it did the exact opposite. Because of this, states will either have to reduce coverage under their Medicaid plans or limit the number of people who can enroll in it. In other words, people who can only afford the minimum coverage that Medicaid provides will now be getting even less from their only option, or maybe they just won't get it at all and die. One thing people absolutely hate about the Affordable Care Act is the fee we have to pay if you don't have insurance, otherwise known as the individual mandate. But good news, that's going away! Kind of. In its place is a 30% increase in your premium if you go more than 2 months without insurance, which is really great until you need insurance. However, the individual mandate going away will send insurance companies into a death spiral, a word I didn't even have to make up myself. And how will that death spiral impact your overall costs? Well, if you've picked up on the trend, it's not good. Without people being required to have insurance, healthy people are going to drop their plans, but with less healthy people paying into the overall pool to cover the cost of those still insured, those who need it, insurance companies have to raise the overall costs. In case you missed that, your costs are going up. On the bright side, you'll probably never have to pay the increased premium because you'll never be able to afford insurance in the first place. Under the ACA, there's a tax credit based on income brackets that helps people pay for their insurance. Under the UWU, that tax credit is based on age, with the biggest amount going to the youngest people and the smallest amount going to the oldest people. Now you might be asking yourself, why is the smallest level of assistance going to the elderly, the people who need assistance the most? Yeah, everyone else is asking the same question. And a quick moment for you economics nerds like me, because of the way that income is distributed across age groups, switching the tax credit from income to age effectively switches it from a progressive tax to a regressive tax. Woo! There's also currently a tax on the super rich, which helps cover the overall costs of coverage. That'll be going away though, which is good for the rich. Yeah, exactly. There's also a special help fund in the new bill for those who can't afford insurance, but that, in combination with the tax credit, still won't be enough to make up for the overall cost increase. But wait, there's more! One part that everybody's talking about is that federal funding will be withheld from any organization that provides abortions. Now, I could go into a huge rant about the GOP's obsession with controlling women's bodies, but we already are fully aware and this video is already too long. This part of the bill is viewed as a direct attack on Planned Parenthood, which Americans oppose cutting funding for 61 to 37%. Other random tidbits you might want to know: your insurance will still cover pre-existing conditions, which makes it accessible. It just might cost you a literal arm and a leg, which means it's not affordable, so I guess it was never really accessible in the first place. There's a random tax break tucked in there for insurance companies who pay their CEOs more than $500,000 a year. I don't really know what it's for, but I like to imagine that it's an attempt to make up for the death spiral that the companies will go into when everyone drops their insurance. There's currently no congressional budget score for this bill, which is probably because it will reflect how bad this is for all Americans. It's basically like if you know you're gonna get a bad grade on a test, you don't turn it in because you don't want the actual red F written on your test. So overall, who benefits and who suffers? I think it's pretty clear that the rich benefit the most with their tax breaks and tax cuts. Literally everybody else is gonna suffer, with insurers having greater risk and everybody else paying more for insurance or losing insurance entirely. I guess you come out alright if you don't have insurance. Until you get sick. There are two big dilemmas here that I want to end with, and the first is economic, because this plan is bad for the entire economy, especially the health sector. But in the long term, we all pay more when people are uninsured, because these costs come out in other places, not just state health taxes. When people are uninsured, they get sick, they miss work, and they can't afford to get better, which is bad for businesses. And those people paying extreme healthcare costs can't afford to buy things and participate in other parts of the economy either. Morally though, we live in a society with the ability to not let people die, and I don't think we should be okay letting people suffer just because they're poor. If you found this video helpful, make sure you give it a thumbs up and maybe even share it to help others. And I would love it if you would comment any questions that you have that I can try to research and answer, or any concerns that you have, and I would love for you to share your stories about how the ACA has helped you. I'll leave you with this, my favorite tidbit from all of the articles that I read, a piece in Vice by Eve Pacer. And don't forget to subscribe. Bye!